Hey everybody, it's Dr. O here from Revitalize Maui, and today we're going to be talking about our Referrum treatment, which is really targeting loose and sagging skin. We're going to review how this works, who it's for, and what you can expect by getting this treatment. Now, I want you guys to make sure you keep watching, because at the end, we're going to have some great information regarding all those things and maybe even get you a little teaser on how you can save on getting this done. This is really for anyone who's got issues with sagging skin, okay? And the reality is, as we age, we lose collagen, elastin, hydration in our skin, and the combination of these effects turns into issues with loose or sagging skin. It can also be compounded with the exposure of sun and cigarette smoking, genetics, things like that. You can actually have issues where not only is skin sagging, but you can have deeper wrinkles. You can have moderate to severe wrinkles. You can lose that shine or that glow in your skin. The skin can take on a sort of gray, dull appearance. Now, when I talk to my patients about what we do to correct some of these issues, of course, you know, we focus on the easy things first. Yeah, sunscreen, 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 some proper use of products, hydration, balancing hormones, things like that. But after we've taken care of the basics, really now we're thinking about what can we do to turn the clock back, to improve the quality of your skin. Ultimately, we want to think about things we can do to address some of these concerns. And in order to do that, I like to look at what's happening anatomically to decide on the correct treatment. Let's just talk about what's actually happening. When you look at skin, there's several different layers of the epidermis. And what we have to look at is what's happening at the top layer of skin and what's happening in the more middle layer of skin. So obviously, things that will resurface your skin epidermal area, the epidermal layer, are going to remove those fine wrinkles, maybe some medium wrinkles, you know, laser treatments, chemical peels, IPL, CO2 lasers, a lot of different things you can do there. But really, what we're really talking about now is what's happening at the deeper layers of skin, where that collagen and elastin is missing. So what we've done with this treatment is combine a really great treatment, industry standard treatment, erbium laser, for targeting the top layers of skin in combination with something to bring more collagen to the deeper layers of skin. When you combine these two things together, we really have a profound impact on skin quality and the tightness of skin. So this is why we call this one Referrum. Okay, so how does this work? What are we doing? So I think we'll start with the deeper layer. So a lot of you have heard of microneedling. You know, I used to be a huge fan of microneedling with PRP, for example. And really what that's doing is using mechanical trauma, micro trauma, to cause the skin to react by building collagen. That's the basics. Really, all these treatments, that's how they work. They cause small amounts of trauma to the skin at different layers to cause your skin to build more collagen. Now what we have here is, this is a radio frequency microneedling platform. You can come in and take a look at this. You could see this device. These are gold pins. She loves only gold. All right, you can see these pins. These deliver energy at different layers as we set into the skin. So when we are doing, for example, the cheek area, we're going to use about specific level of power at 1.2 to 1.5 millimeters into the skin. It gives a mechanical trauma like you'd get from microneedling, but there's additional thermal injury that shrinks the dermal tissues and causes an even greater release of collagen over time to do what? Firm those deeper layers of tissue. Now, we combine that in the same treatment with one of my favorite treatments for skin resurfacing, the erbium laser. Now, this laser targets water as a chromophore. It uses the wavelength 2940 nanometers. This is very important because this wavelength does not affect melanin. It doesn't affect hemoglobin. So it's not really looking for pigment, hair. It's really focused, it's really vaporizing tissue, okay? So what we do is we use that one to vaporize a layer of about 100 to 130 microns of tissue, the top layer of skin, so that you remove that old skin and your body is forced to regenerate a new fresh layer of skin. Now, how do we compare this to something like CO2 laser? Well, this is a much more gentle and lower downtime treatment. You're not going to be swollen and peeling for 3-4 weeks like you would in the old days with the deep CO2. This is a kinder, gentler way to do this. Now, because of that, we're going to do both of these treatments twice, about 4 to 6 weeks apart. And what we find is when we do it this way, we have excellent results, we have low downtime, and it's controllable. We're going to tailor the treatment to what your needs are. If you need more, we'll start off a little bit higher energy levels, repetition levels, more passes, and we'll be able to really deliver a fabulous result for you. Now, the other thing I want to point out with this treatment, there's actually 2 parts to it. What we do first is a fully ablative erbium treatment using a 6mm spot size. And what that means is we are totally removing the skin, okay, in little 6mm chunks. So it takes a fair amount of work, but we blast off all that skin, really revealing really, really smooth skin below. We then follow that with a fractional lens. Now, what does that mean? A fractional treatment is one where it's not removing a full layer of skin, it's actually targeting deeper into skin layers, small columns of energy. And the benefit there, again, is lower downtime, but we can actually penetrate a little bit deeper without having significant side effects. We combine those two. So this treatment, you actually do 2 separate erbium treatments, and then we follow it with the Pixel 8. Okay, so here we're doing 3 different treatments combined in one. And what we find is when we do it in this way, there's a synergistic response between these 3 different layers and 3 modalities, and the end result is a better result, lower downtime, and ultimately greater satisfaction.